This call may be recorded. Thank you. You will now be connected.
This is the 2-minute warning. Please press 1 to ask a question.
Good afternoon, everyone, and thank you for joining today's update on COVID-19 in North Carolina. UNC-TV is providing a stream for sign language at unctv.org. As of today, we have 12,256 confirmed cases, 534 people in the hospital, and sadly, 452 deaths. We pray for those we've lost, and we pray for their families. Over the past several weeks, North Carolinians have done hard work, staying at home, keeping a social distance, and wearing face coverings to protect their families, their friends, and their neighbors. The good news is that your work has prevented an overwhelming spike in infections like we've seen in other states and other parts of the world. The harder news is that there is still no cure or vaccine for COVID-19. And the virus continues to circulate. Because of this, we have to be cautious and methodical with plans to ease restrictions. Removing them all at once would cause a surge in new cases, more people in the hospital, and more North Carolinians dying. We have to keep taking precautions to keep people safe. But at the same time, we know we can't stay in our homes forever. We'll now look ahead to the next step for our state and the executive order that ends on Friday. I'd first like to ask Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, to go through today's data so people can see more about testing, tracing, and trends, and the indicators we're watching to help guide our decision. Dr. Cohen.
Thank you, Governor. And thank you for continuing to stay at home so we slow the spread of this virus. You're protecting your family members, friends, and neighbors who are at higher risk for more serious illness from COVID-19. Before I dive into our overall trends, I wanted to highlight some new data we put up on our website today showing how many people in North Carolina are at high risk for serious illness from COVID-19. And what the data shows is that quite a few people in our state, just over half of all adults, are high risk because they are either over 65 or have at least one underlying condition or both. Let me break this down for you in a graph and look at it by age. In this figure, you can look at the darker blue portion. It shows the percent of people in each age group who have at least one underlying health condition that puts them at higher risk for serious illness. you can see that 27% of North Carolinians between the age of 18 and 24, 36% of people between 25 and 49, and 49% of people 50 to 65, and 56% of people 65 and older all have at least one underlying health condition. So you can see the risk is not just in folks that are over 65, but it exists across all ages. And we need to keep that in mind as we move forward. So even as we move slowly to ease restrictions and modify the stay-at-home order later this week, we cannot lower our guard. Okay, so now let's recap the set of measures that we're looking at to guide our decisions and to ease restrictions. It's these same 4 trends and capabilities that we've been talking about for a number of weeks. Those 4 trends are COVID-like syndromic cases, lab-confirmed cases, positive tests as a percentage of total tests, and hospitalizations. Again, these were chosen based on public health data as well as White House guidance. Also a reminder, we cannot look at any one of these metrics in isolation. They all have limitations. And in addition, we have to look at that data in the context of North Carolina. We did something that every state and country is trying to achieve. We flattened the curve. That means we have to look at our metrics a bit differently. We aren't seeing significant downward trajectories on most metrics, largely because we were successful in the first place preventing a sharp peak. We look relatively stable on these metrics that I'll go through, and that's a good sign. All right, let's look at our first metric. This looks at people who come to the emergency department with COVID-like symptoms. This metric serves as an early detection mechanism. Our full surveillance report will be posted on Thursday, but here's an early look at the most recent data that shows a continued decline, and that's great news. So I'm drawing your attention to that yellow line. We had a little peak up, and then it's gone back down, so we're in good shape there. Let's move on to the next graph. When we look at laboratory confirmed tests, we're looking at that yellow line again, that is our 7-day rolling average. We see a slight increase, but you can even see towards the right-hand side, it's starting to level. We're going to keep watching this. And remember, we've been doing a lot more testing. So the fact that we see a slight increase in cases is expected. Okay, next graph. You'll see how the previous graph and this intersects. You'll see the increased testing play out here. The percentage of those tests that are positive, you'll see by the yellow line, is going down, and that's a good thing. So while we're seeing slightly more positive cases with the increased testing, the percent positive continues to go down, and that's good. Next trend. The last is about our day-over-day hospitalizations. And this graph shows that we're largely level and we have the capacity that we need to meet increased demands if more people become ill. Also a good sign. So let's wrap up. Where are we right now? Our surveillance data shows a decline, green check. Currently, North Carolina's trajectory of lab-confirmed cases over the last 14 days, as I said, still increasing slightly, but start to see a leveling there. I'm not ready to give it a green check yet, but we're not seeing spikes. We're not seeing any rapid increases in numbers, but we're going to put an X there for now. Again, we're doing more testing, so we know this number may not go down for a bit. Currently, North Carolina's trajectory in terms of percent of tests of return positive over the last 14 days is declining. Green check, good. So two greens, a red, and on the 4th, we said hospitalization is largely level, and we have the hospital capacity we need, and that is good, so green check. Just a reminder, going through some of our capabilities, the things we've been working on in addition to the trends, looking at testing and tracing. We are doing twice as much testing per day than we were just a few weeks ago, and that's good. For tracing, more than 4,000 people have applied to the Community Contract Tracing Collaborative, and hiring's already started, so that's great. And then supply chains, with the exception of gowns, are improving, so we're headed in the right direction. We're not perfect, but we're stable. And you may recall that when I first shared these metrics a few weeks back, I said that sustained leveling would be okay for North Carolina. We've never had a spike or a surge, so continued stability in these trends is a real positive for our state and a testament to aggressive early action taken by the governor and your resolve to save lives. So before I turn it back to the governor to walk you through how we're going to take these positive results and now move forward, we want to make sure that we continue to protect our loved ones and our neighbors. We still want you to stay home. And if you're sick, you should definitely be staying home. If you do leave home, we have a new way for you to remember what to do. It's what you've been hearing all along, but now as you think about them, I want you to think about the 3 W's: wear, wait, wash. Wear face coverings, wait 6 feet apart from other people, wash your hands often, wear, wait, wash. All right, those are the 3 W's. And with that, I'll turn it back over to the governor. Thanks so much.
Thank you, Dr. Cohen. As you can see, North Carolina's approach is grounded firmly in the data, the science, and the facts. Because the combination of our indicators tell us that our trends are mostly decreasing or leveling, I've signed an executive order to move North Carolina into phase 1 of easing restrictions. This order begins Friday, May the 8th at 5 p.m. So what does that mean? First, I want to be clear. North Carolina's stay-at-home order will remain in place, but it'll be modified to allow more reasons for people to leave home and to allow for more commercial activity. Phase 1 removes the designations of essential and non-essential businesses. That won't be there anymore. Therefore, more businesses will be open. Retail stores now will be allowed to increase to 50% capacity as long as they can implement social distancing and frequent cleaning. The order allows people to leave home to visit any business that is open, and it encourages parks and trails to reopen. The businesses that were specifically closed in the order we're under right now will remain closed in phase 1. And these are businesses like personal care, such as salons or barbers, and entertainment venues like theaters, bars, gyms, pools, and playgrounds. Restaurants will continue to be open for takeout or delivery only and closed to in-room dining. These are businesses where social distancing is difficult, and they will have the opportunity to open and do more in phase 2 when we get there. Gatherings. We've heard a lot about public gatherings. Gatherings in this order are still limited to 10 people, but people will be able to socialize with friends as long as they're outdoors and they are socially distant. In phase 1, people are still encouraged to telework when possible. And as certain businesses come back online, we know that the need for childcare will increase. And phase 1 will allow childcare centers to re-enroll children whose parents are back at work or are looking for work, as long as the centers follow strict cleaning requirements. We are paying attention to First Amendment rights, such as protesting and worship services. Under this order, these activities are allowed outdoors with more than 10 people as long as there is social distancing. There is still significant concern about gatherings of more than 10 people indoors, particularly where people are standing or sitting near each other for more than 10 minutes. The chances for spreading the virus are significantly greater in these circumstances. Phase 1 in North Carolina is a careful and deliberate next step. We have flattened the curve, but we hadn't eliminated COVID-19. We'll continue the stay-at-home order because it's still best for people to stay at home, especially those with underlying health conditions. And when people do leave home, we want folks to remember the 3 W's: wear a face covering, wait 6 feet apart from other people, and wash your hands. Cloth face coverings like we wear here in the EOC, the Emergency Operations Center, can be simple and homemade. The main purpose of a face covering is to protect other people in case you have COVID-19 and just don't know it yet. This protection works best if you also wash your hands and wait 6 feet apart from other people. This order that I've signed today, it will take effect on May 8th, and it is set to expire on May 22nd. But if our indicators are not in the right place, we'll extend Phase 1 longer than 2 weeks. We are easing restrictions in a data-driven way. Now, I know people are eager to work and eager to play, but I know that people are also worried about how this virus could affect them and their families. Feeling that impatience and that concern at the same time is difficult and confusing. Phase 1 is designated, and Phase 1 is designed to be a limited easing of restrictions that can give people safe opportunities to socialize and boost parts of our economy while keeping important safety restrictions in place. You know, we can only boost our economy when people have confidence in their safety. Fighting this virus requires all of us to do our part. I've seen countless stories of North Carolinians looking out for each other as we work to make it through day by day. In fact, whenever you stay home or sanitize a grocery cart, go out wearing a face covering, stay physically distant, you are looking out for your neighbor. These stories about people give me hope. They remind me that even though we're not physically together often, we are still in this together. In addition to Dr. Cohen today, we're joined by our Secretary of Public Safety, Eric Hooks, and our Director of Emergency Management, Mike Sprayberry. Monica McGee and Connie Jo Hutchinson are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We're now going to take questions from the media. We'd ask you to identify yourself first and then state the name of your organization, and all of us here will be available to answer questions. So we'll take the first question.
Our first question will be from Ken Smith, WRAL.
Good afternoon, Governor, Dr. Cohen and others. Ken Smith with WRAL. As we look to move into Phase 1, what most concerns you?
I'm sorry, can you guys turn up that volume because I did not hear that? Can you try that?
Can you try that again, Ken? Sorry about that.
Sure, no problem.
I heard it was you, but I didn't hear the question.
As we look to move into Phase 1, what most concerns you? Because last weekend we saw when some of the coastal communities opened their beaches, people flocked to those beaches. A lot of people were not practicing social distancing. So as you ease restrictions starting on Friday, what most concerns you?
Yes. What would concern me is that the people begin to not take this seriously and not be concerned about the safety restrictions that we need to make sure that we have in place. That's why it's important for people to remember that we are continuing the stay-at-home order. We would rather you stay at home. But we also know that people do want to get out. We do want people to go and visit their physicians and go to the hospital to get needed treatment that they may have other than COVID-19. And we need to give a boost to our economy. And we have examined this carefully and believe the data shows us that now is the time to begin easing these restrictions, and we're doing it cautiously and carefully. And I think for the most part, even though you see sometimes people not paying attention, and those are glaring often, For the most part, North Carolinians have been pretty good about observing social distancing and staying home as much as they can, and that's been evidenced by the fact that we have flattened the curve. So I'm very hopeful as we enter into phase one that people will continue to be careful and that we can give a boost to our economy and that we can continue to move through these phases in a safe way, giving people confidence. Thanks for that. Next question, please.
Andrea Blanford, ABC 11.
Hi, Governor. It's Andrea Blanford with ABC 11. Are there plans to appoint a particular committee or task force that will be responsible for enforcing the protocols that you've laid out in your executive order for these businesses to reopen? You've talked a lot about the importance of consumer confidence in this process, so just how can we be sure that a business is complying with the safety measures you've laid out? Thanks.
Thanks. For the most part, businesses have been strong in their response, trying to protect employees and also trying to protect the customers in their stores. And we expect people to follow these orders. And for the most part, businesses have been very interested in them and have worked hard to try to comply, as have everyday North Carolinians. These are still enforceable by local law enforcement. It is a misdemeanor to violate the order. And most of the law enforcement officers around the state, there have been some arrests, but most of the times they handle this thing by telling people, hey, this is a violation of the order. Please don't do this anymore. And it usually works out. That's the way we want this to happen. We want people to be in this together, look out for each other, try to follow these rules, because that's going to get us where we need to go, both with keeping people safe and helping to boost our economy. Thanks. Next question.
Jonathan Alexander, News and Observer.
Hi, this is Jonathan Alexander with the News and Observer. I have a few questions. How is the timeline coordinated with other states? You mentioned before that you were going to talk with Georgia Governor Kemp. Just wondering what the result of that conversation was, and the conversation with, or whether there were any conversations with Virginia Governor Northam. I was also wondering about summer camps in sports, and whether there was any updates on when that might occur.
Thanks. We are concerned about what happens in other states because the virus doesn't respect state boundaries, and I have expressed my concerns to the governor of Georgia regarding their opening of more businesses than North Carolina is opening right now. We're concerned about how fast they are moving. We hope that that turns out well. We hope that more people don't get sick, and we hope that it doesn't result in a downward trend of, or an upward trend of having more cases. And we're continuing to work together as governors to make sure there's more testing and tracing and taking good ideas from each other as well. Summer camps, day camps are allowed under this new executive order as long as they follow the CDC guidelines. There will not be overnight camps this summer due to the order, but day camps are allowed, and Dr. Cohen has provided with the Department of Health and Human Services the CDC guidelines that these camps have to follow. Thanks. Next question, please.
Chandler Morgan, WBTV.
Hi, Governor Cooper. This is Chandler Morgan from WBTV. Had a quick follow-up question to the question that I asked yesterday. You answered saying that we go into the phase one of reopening, you said that it was going to be 14 days, really, that you would have to have data collected in order to make a new decision. My question for you is, do you feel like 14 days is too long of a time to be waiting where something could be going wrong for the state?
Well, 14 days gives us an opportunity to look at all of the trends. There are a lot of reasons why data could be different coming in day to day. It may be a delay in reporting by a hospital or a health department. So you want to wait 14 days in order to be able to see your trends. And we're not going to go into another phase without making sure that our indicators and our testing, tracing, and trends are headed in the right direction. And that's why we wanted to wait. Will be really important for us to continue to look at, and we're going to be driven to make these decisions by the science and the facts. And I think people expect that, and it will give people more confidence in their safety, and that will help our economy when people are more confident to go out. Thanks. Next question, please.
Kate Martin, Carolina Public Press.
Hi, Governor. This is Kate Martin with Carolina Public Press. I have a couple of questions, probably for Dr. Cohen. On the 23rd, you said that hospitalizations were largely level, but we're not decreasing, so we're not there yet. And now you're saying that they're level, and I'm kind of wondering why that message has changed a little bit. The other phrasing that you're using is you're saying that these metrics are stable, but in a lot of cases, they're really climbing slowly. Are you saying that they're flat, or are you saying that they're rising at a slow, consistent rate? I appreciate your answer.
Hi, Kate. Thanks for the question. So on hospitalizations, given the amount of hospital capacity that we have, a fluctuation even up or down of 100 people, still we have a lot of capacity in our hospital system. So that's why I feel confident saying these are largely stable as we look at those hospitalizations. I think when we were looking at it a first time, we wanted to see a longer period of time of that stabilization, but now we have certainly given it the amount of time, and we are largely seeing that stability. And we are tracking to make sure that we have not only acute bed availability, but ICU capacity as well. So we feel very good about our ability not just to have capacity now, but to surge into the future. So I feel really good about where our hospitalizations are, as well as an indicator that we're largely level in terms of folks who are getting quite ill from COVID-19. So I feel good on that. And as I look at those other metrics, right? So our surveillance data is declining and going down, and we're frankly almost near the bottom of where those trends are. So I do expect going forward in the future to see a leveling. We're almost as down as we could get on things like our surveillance data. So I do expect to see, a slight up, a slight down. And that's why I think the governor was saying that we have to look at this over a period of time. You can't look at any one day and make a decision. You have to know, was that an anomaly of data or one thing happened? And so that's why we want to look at this data over a period of time. So our surveillance data coming down. Our case numbers, as I was sharing before, are going up. But that's in the context of twice as much testing. And we're really only going up slightly. And as you saw in that graph, you could see even in the last few days started to level. As going back to saying was we need more than a couple of days to really know that, so I wasn't ready to give it a green check yet, but we'll keep watching those trends. And I do think that shows overall stability for our state, because as I said, when you double the amount of testing and we are largely about where we were with a slight increase, that's a good sign to me that we are stable. But it is also why we are being cautious as we take this first step. We're not opening everything back up all at once. We are taking those cautious steps. We are saying stay at home. Now there are more reasons you can leave home. And when you do it, we want you to follow the 3 W's. But we know that stability is the picture we have. We want to keep it stable. And I think that's why we're doing this cautious and very appropriate and measured step forward as we work through and continue to watch this data. Thank you.
Thank you. Next question, please.
Derek Dellinger, Fox 46.
Yes, I have a bit of a two-part question in regards to things getting back to normal. School start dates and university start dates, we're starting to see some of them have been pushed back somewhat. Also, I'm wondering if you have any guidance for offices. There was an economic roundtable discussion that was happening yesterday. People were asking when people could get back to work in Charlotte because there are a lot of offices here, especially in Uptown. Is there any guidance that you're giving to schools, universities, or for that matter, offices to get back to normal?
Well, first, we are hopeful that our schools and universities will be operating in the fall. We know that most likely COVID-19 will still be here, but we hope that we will have flattened the curve and will have instituted safety measures, social distancing, sanitizing, to make our schools and universities as safe as possible. And people are working on those plans right now to make sure that can happen. These offices, most all of these offices that you may be talking about in Charlotte, could have people in them now if they wanted to under the executive order. However, we've encouraged people to telework as much as they possibly can. And when talking to a lot of office business people that I've talked to, teleworking has been largely successful throughout our state. You may see that employers will have to make this choice themselves, but you may see gradually people going back into the office. You may see people going in shifts, like half of the people may go to the actual office one day, another half to stay home, and then vice versa. So I think employers are being creative about making sure that their employees are safe but still getting their work done. And we've provided recommendations for all of these employers to keep their employees socially distant, to keep things clean, to wear face coverings in the office space. Those are the kinds of things that we want them to do so that we can ignite our economy and stay safe at the same time. Thanks. Next question, please.
Lakewood,
lineage, including healthcare officials, are still skeptical about moving forward in reopening North Carolina at this time. My question specifically to you surrounds the fact that, I'm sorry.
Still there?
I'm sorry, I can barely hear you.
Okay. I can hear you. I heard the question, the beginning of the question.
Yes, are you doing this based on the fact that health officials have provided you with this knowledge, or based on pressure put onto your office by protesters, especially those involved in the Reopen NC movement?
We are basing these decisions only on the evidence, the science, and the facts, and the determinants that we have set forth. Health officials are driving when we make decisions about moving into phases. We're getting input from employers and businesses about how we do it and what kind of restrictions are in place. But this is a totally data-driven decision that I think is positive for the safety of our state and hopefully to get our economy moving more as well. Thank you. Next question.
Colleen Quigley, WNCN.
Hey, good afternoon, Governor Cooper. This is Colleen with CBS 17. My question is in regards to business owners and even groups like the North Carolina Chamber who would like to see businesses like salons and gyms, personal care businesses open sooner so long as they can social distance, workers wear gloves and masks, and they open by appointment only. What is your response to those people?
We've consulted with the North Carolina Chamber of Commerce, and in fact, I've actually read the plan that they proposed, and a lot of the things are similar in what we've done. But those kinds of businesses, it's almost impossible to social distance, and until we're able to stabilize the testing, tracing, and trends, those are the kinds of things that we believe should be open in phase 2. And under supervision with some strict rules for protection of clients and customers. So we're going to continue to work with all of those businesses and with the chamber. And when we get into phase two, we'll be talking about opening some or all of those businesses, and look forward to working with them when we get to that point. Thank you. Next question, please.
Katie Peralta, Charlotte Agenda.
Hi, Governor Cooper. This is Katie Peralta with the Charlotte Agenda. Just hoping to kind of look into the future here if possible, based on current trends and how well North Carolina is doing with social distancing and mask wearing and things of the like. Do you think that it is likely that we will be able to move into phase two on May 22nd at the rate that we're going right now?
We are hopeful that is the case, but we're going to wait and look at this data. Today is May the 5th, and that's a little over 2 weeks away. So we'll get to see the numbers as they come in, and we'll make the decision at that time. The health and safety of North Carolinians will be the #1 priority. And in order for our economy to thrive, people need to feel safe, and they need to trust this process. And I think most North Carolinians do, and that we're going to make decisions based upon their health, and we will make those decisions when the time comes. We're hopeful, but we'll see what the data tells us, and we'll make the decision accordingly. Thanks. Next question, please.
Our final question today will be from Marissa Pansino, WFMY.
Hey, Governor. Marissa Pansino with News 2 in Greensboro. Should things start to get worse again with this virus or data be unfavorable, would North Carolina have to pull back out of phase one or phase two or wherever we are at that point and fall back into tighter restrictions? And how big of a concern is that?
We would be guided by what the numbers told us. And yes, when we started this process, we said always that there was a chance that we could have to retreat if our numbers went the wrong direction. So we're going to look at it carefully. What we would do likely if our numbers continued to inch up and we were not in our combination of indicators like where we wanted to be, we would probably just extend phase one. If we really began to see a surge, then yes, potentially we could go backward and impose some tighter restrictions. We've got to save people's lives. We've got to make sure that people are safe. That's why we're using these facts in order to make the decisions. And the people of North Carolina can play a significant role in this. As we ease restrictions, people still have to have it in their mind that, yeah, I want to go out and I want to work and I want to play, but try to protect your neighbor. Wear that face covering, particularly when you can't be socially distant from people. Continue to wash your hands. Continue to do the things that you need to do to protect your family and your friends, and keep it in mind. And I think when people start living like that, North Carolinians have been doing well so far. Let's just remember how safe we've got to be and how careful we've got to be. And we look forward to brighter days ahead for sure. Thank you all for being with us today. We appreciate it. Stay safe, everyone. We look forward to coming back another time this week. Thank you.